benefit from this. So with that, I would like to transition to the next panel. In the next panel, we're going to hear
You're on mute.
Sorry, we can't hear you.
Oh, Dr. Grace, are you there? That's the other panelist. Okay, if not,
yeah, we couldn't hear you.
Oh, okay, great, fantastic. So good to see you both and have you here. So the first question, based on your experience as community organizers, what has been the biggest misinformation that you've come across? I'll go with you first, Dr. Grace.
Okay, thank you for having me. As a community, in the community, what we hear is the trust. If the vaccine is safe, people are afraid, and so they said it was rushed. The vaccine was rushed, and because it was rushed, they don't think it was safe. So for us as community organizers, so we try to put information out there to let them know that yes, it takes about 7 to 10 years to develop vaccine, and so people are afraid that now within 3 months, 4 months, then you have the vaccine. So how can we trust that the vaccine is safe? And also that was one. And another questions that people ask in the community is that for us, for most Christians, they will tell you, because I'm in the Nigerian community, that it's not my portion, that kind of language, that God will not allow it to happen to me. I'm a Christian, so I'm covered by the blood of Jesus. So these were the informations, we're hearing, and we try as much as possible to provide factual information. As a health administrator, I see this firsthand, the virus, how it has devastated, and a lot of family has lost their lives. So I use that, to present to the community that yes, this virus is different. Although the vaccine came out quickly, but it's because of the pandemic. So the community, the government put a lot of money towards the production, but the safety was never minimized. There are still safety measures were put in place to produce that. And so we now provide, what we did right here is to make sure that those healthcare workers that see firsthand experience of the death, like in New York, where the epicenter, those hospitals where patients were dying, to bring them out so that they can speak to the community. That was very effective. And for those who have lost their loved ones, so we have members of the community that either their spouse have died, they were able to come out to share their experience, with the community. That also helped, to reduce hesitancy. So when the vaccine came out, we also saw a big difference. Recently we had a family of 4 where 3 were not vaccinated and 1 was vaccinated. 4 of them were admitted to the hospital. 3 of them died that were not vaccinated. And the mother, who was 74 years old, that was vaccinated, although she was admitted for 2 days in the hospital, she came back. So we also enlisted her as an ambassador to speak about our own experience, to see that the vaccine is safe and really help to save the family. So that is what we're doing. And I agree with what the doctor had said, is to enlist for us to coordinate. We need a coordination in information sharing. We need factual information to go out to counteract those misinformation. And we need our leaders, especially faith-based leaders, to be at the forefront, because about 90% of the poll that we had said they will take the vaccine if their religious leaders advise them to do that. So we want to really make sure that the religious leaders are knowledgeable about this vaccine so they can be also ambassadors. And I like what you did is to ask people if they be vaccinated, so you can't really say things when you are not. So the first thing we did also was to ensure that the community leaders that have already gotten their vaccine are at the forefront of bringing the information out. Another area that was of concern to people was that, well, if you take the vaccine, you will die or you will change to animal. So we're able to demonstrate, I think over what, billions of people, doses have been administered, and now we're sharing that nobody has turned to animals. Nobody has electricity. I think you see some videos that shows if you take the vaccine, there you become your electricity or the magnet that is put into that. So it's actually to take this concern very seriously and address them factually, to give factual information about it, So I went to Nigeria in August, going to rural areas. One of the concerns in Africa that I think we should address is that they're saying, we didn't have people dying in Africa the way they were dying in Europe or in America. So why are you forcing the vaccine on us? The vaccine don't belong here. So that is a major concern. If you have people in Africa saying that we didn't have a lot of people dying. So the way we're addressing that is that for vaccine is a prevention, is to prevent. So you don't have to wait to die to get the vaccine. You have to get it now so you are protected before you get the infection come there, if you agree that you don't have the virus in the community. So those are the areas we're addressing right now. Thank you.
Thank you. Oh, that's excellent. I like what you said about, taking the misinformation seriously and addressing that with facts, factually. I think that's really, really important. And I also actually think that, it's frontline healthcare workers like you who've experienced it that can really work with the, religious leaders like the Imam and Pastor Adioye and all these people to partner, to really become even more effective. I'm going to turn it over to you, Ms. Amisa. So, same question to you. First of all, do you mind sharing your vaccination status and how did you also arrive at that decision? And then give some perspective on what are some of the misinformation that you've heard and how you were able to address that.
Okay, thank you. So I think that's a very important question, that asking if we have been vaccinated or not, because we ideally cannot be ambassadors of vaccination if we have not been vaccinated. So I have been vaccinated, and what led to this was I actually took vaccination in Kenya when it was the first round it came, because I was working at the community level and I used to do a lot of psychosocial support, mental health services at the grassroots level. So I had to take it, and even at that time when it was the first time it came to Kenya, we could see that even the forefront workers who were supposed to get it had actually the stigma against it, because there have been that myth around it. And just knowing that I had to engage with other people, and it was not even about me, it was about me protecting them, was actually what led me to take the vaccine. Now, with there have been very, very myths, which I'm so glad that they have been touched before. The first one is about the actually people saying that in Africa and Kenya, we did not have a lot of casualties or people dying from the vaccine. So that means that this is just a Western kind of thing, which is brought upon us because they want to kill us, the same way they brought Ebola, the same way they brought AIDS to us. So it is so hard to actually change in the mind of people. And this actually came from people who are actually elderly. So what we have been doing with that misinformation is that we work with the youth. We know that it is so easy for youth, the ones that we engage in, to change their attitude and their perspective towards vaccination. And if they do that, it will be so easy for them now to be the ambassadors and go back to their families and ensure that the people who are close to them are actually in a position to get the vaccine. So an instance that a friend of mine who we usually work with, the parents who are elderly refused completely to take the vaccine. Even the church leaders could not convince them. Nobody could convince them. So because they were told that they will die and all those kind of things. So what we did is that my friend actually went and took the vaccine herself. And then after that, she went online and booked for family for a specific hospital. And then when the day of the vaccination came, she took the cab and took them to take the vaccine. So And before that, they have somebody who is a mental health practitioner to sit with them and help them process the information. Because I think one of the things that we have forgotten is accepting that this thing is new for people, and that if it is a new thing, people will have different ways of processing it and accepting it. So sitting with people, understanding them, making them process the information that they have, process the emotion around it, and then making the decision what has been working mostly for us. And then the other thing has been for young mothers who I work with a lot. They said that if they get vaccine, they won't be able to give birth in future and all these kind of things. So we actually had individuals who believed in vaccine who actually unfortunately had lost their family members through COVID-19. So those people automatically became ambassadors, because they were like, if my family member passed away due to COVID-19, that means it is very serious. And if it is serious, I'll be the first one to take vaccine and help be the ambassador of making sure that people are understanding the importance of it and are able to go and take the vaccine. So using the people who have already experienced loss through vaccine to actually stand up, share the experiences, and tell people that whatever they're feeling, it's okay, but they need to take action, because COVID is here to stay and vaccine is the only solution as per now to assist in the COVID situation.
Oh, wow. Thank you so much for sharing those insights and that response. I just want to call on people who are attending to put questions in the chat so that we can channel those to the panelists. So let me come back to you, Dr. Grace. If you had just one word to tell other people who are, fighting like you in the communities to get people get more vaccinated, what would be your advice to them?
Get vaccinated for you to live. You said health is wealth, right? So health is wealth. Without health, there is no wealth. So if you're not vaccinated and you get sick, you can't really do what you want to do. So it's very important for us to focus on our health, to make it a priority. And so one of the ways we can do that when we look at holistic health is preventive measures. So for you to be safe, you want to make sure that you are vaccinated. And usually also we go over other vaccines that are out there.